Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily.
And my name is David. Today, we're diving into sensory testing. One of those topics that can be straightforward, but when it shows up on that NPTE, the key is knowing which sensory pathway is being tested and what that means for lesion localization. All right, here's a question. A patient presents with impaired vibration sense and proprioception in both lower extremities, but pain and temperature sensation are intact. Which spinal cord structure is most likely affected? Is it option A, spinal thalamic tract? Option B, dorsal column medial lemniscal pathway? Option C, corticospinal tract? Or option D, spinal cerebellar tract?
All right, so let's look at each option choice. First up, we have option A, which was that spinal thalamic tract. This carries what? This carries pain as well as temperature sensations. The question said that pain and temperature were both intact, so this tract would not be the issue. So we can eliminate option A. Next up, we have option B, our dorsal column medial lemniscal pathway. That is a mouthful. Or our DCML. Now, this pathway transmits fine touch, vibration, and one other thing, proprioception. Exactly what's impaired here with this patient case. Damage to this system causes loss of position sense and vibration below the level of lesion, often seen in various conditions and even things like vitamin B12 deficiencies. Something to note here, option B would be the correct answer choice. But let's review C and D. Option C, that corticospinal tract. This one is only motor, not sensory. Think voluntary movements would be impaired here. So we can cross off option C. And then finally, option D, we have our spinocerebellar tract. Good guess for coordination or balance issues, because this is what that tract could show limitations with. But this tract also bypasses conscious perception. It carries proprioceptive information directly to the cerebellum for coordination, not necessarily sensory awareness. So it wouldn't explain things like changes to vibration or position loss. So we can cross off option D, meaning that yes, option B, our dorsal column medial lemniscal pathway or our DCML tract was the correct answer choice for this patient case because that patient had impaired vibration and impaired proprioception in both legs. Good job.
All right, let's summarize this a little bit. The dorsal column, that's going to be for vibration, fine touch, and proprioception. Spinal thalamic, that's for pain and temperature. Spinal cerebellar, that's for unconscious proprioception for coordination. And then corticospinal, that's motor.
All right, so want some great test day tricks? Because I know everybody listening right now would like to know some extra little tips and tricks to make sure they succeed on that exam. So if your question stem says loss of vibration and proprioception, think of that dorsal column. If it says loss of pain and temperature, go with that spinal thalamic tract. And if they throw in words like ataxia or coordination issues without any mentions of sensory loss, you're probably looking at that spinocerebellar tract. So when you get sensory questions on the NPTE, don't memorize, visualize. Picture where that pathway runs in the spinal cord and ask yourself, is this conscious sensation, pain, or coordination issues? Understanding why the sensation is lost is how you separate yourself from guessing and start thinking clinically to not only help you on the exam, but also as a future clinician.
Now that you listen to this episode, here is a quote. The moment you're ready to quit is usually the moment right before the miracle happens. Don't give up. That's right. Don't give up. You don't know if you are right there, but you could be right there. So why are you going to stop right now? You've gone too far. Keep on going forward. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, X, and TikTok.
Till next time, have a great day and a powerful tomorrow.